My name is Daryl Alvarez, and I'm the founder of Generations for Health, a youth-led organization that wants to connect the youth with world health leaders in order to promote the creation of solutions that takes into account the transformative power of the youth, their opinions and decisions in global health matters. In the last couple of months, we have been focusing especially on the climate health nexus and planetary health. Climate change is one of the greatest threats of our times, affecting us and the planet at every level, and health is not an exception. Hundreds of thousands of lives are being lost every year due to climate change. The direct damage cost is estimated to be between 2 to 4 billion US dollars every year by 2030. Climate change has already affected access to safe drinking water, food security, clean air, and even adequate housing, and has changed the infection patterns and their geographic location. Although climate change is affecting all populations, certain populations in certain countries with weak health system infrastructures will be the most affected by it and won't be able to cap the consequences of climate change without external support. That's why close cooperation between all actors is essential in order to be able to face the challenge that climate change poses to our health. Although close cooperation has been promoted between governments, international organizations, NGOs, and even the private sector, there are almost no strategies that aim to promote an active role of the general public and especially the younger generations. In the last decades, young people have shown great strength, creativity, and to demand action and to ask for changes in their communities and create those changes and solutions. But sometimes the link with health is a little bit blurry. The right to health and the health sector can feel very distant and specialized for the general public, especially for younger generations, making them feel that they have no influence of power over it or to influence their decisions that are taken in that sector. But the truth is that they do have power and they do have the influence on those decisions. If there is something that the COVID-19 pandemic has clearly shown to us, is that the right to health is not isolated. It's closely interconnected with other human rights, such as the right to education, the right to work, the right to non-discrimination, or even the right to access to food. All of us can have a role and should have a role in protecting the right to health under the current climate emergency. Developing strategies at both local and global level that promote the participation of the general public, especially the younger generations that are going to be the ones taking the lead tomorrow and the ones most affected by the consequences of today's decision, is pivotal in order to fight the current climate emergency and ensure the right to health for everyone. We need to make the health sector and the right to health more accessible to everyone. Each of us has the power to change the world, and we should never diminish the power that individuals have. In the fight against climate change and in the fight for the protection of the right to health, we need the involvement and the courage of each of us.